Good morning, everyone. Is everyone good to go? So I will firstly today provide an update on the COVID-19 situation in the Northern Territory, and I have with me the Acting Chief Health Officer, Dr. Charles Payne, who will also provide comments and also answer any questions. And then at the end, I do propose to address the parliamentary sittings, which begin for the final time tomorrow. So for Territorians, I can update that we had 2 cases of COVID-19 recorded overnight, and that brings our total case numbers in this cluster to 58 individuals. And of course, we wish all of them a speedy recovery. The first case from yesterday evening was a 17-year-old girl. She is from the Binjari community. She is a household contact of previous cases, and she has been in the Centre for National Resilience for the entire time of her infectious period, so no risk to the Territory community, and we of course wish her well. The second case is also a member from the Binjari community, a 19-year-old woman, and she has tested positive within the Binjari community as a part of the 3rd round of testing that we did yesterday. And so herself and her household contacts will be brought up to Darwin to the Centre for National Resilience. It's not unexpected that we had cases from Binjari community yesterday. We undertook significant testing. We had 153 tests conducted in the Binjari community, and we will continue a testing regime to ensure that we can get on top of any cases within that community as early as possible to care for them. And because Binjari is still under that hard lockdown conditions, we're confident again that that case is not a threat to the Northern Territory community. And I'd just like to acknowledge the residents of Binjari. It's certainly very hot in the Katherine region and they're doing a great job. So we thank them, all Territorians thank them. By them staying at home, not moving about, they are, as these cases come about, not putting our broader community at risk. So we will do a further round of testing in Binjari tomorrow, and we'll certainly update the community as we start to get those results through. Still in the Katherine region, we had the wastewater testing come in last night, and we have a presumptive positive still for Bicentennial Road, which is weakening, and Dr. Payne will speak to that further. But there was also another presumptive positive for Chambers Crescent, which is upstream of Bicentennial Road. So Dr. Payne will talk more about what those results could potentially mean. They're very low readings, but it's important for anyone in Katherine, if they're feeling slightly unwell, to please reach out to get tested. It could be someone shedding the virus, or it could be another case that we do need to become aware of. So it's really important, if you're symptomatic in Katherine, to please get a test. On to Lajamanu, I'd like to acknowledge the amazing work of everyone that has supported the Lajamanu community since Saturday evening. Our rapid response team has gone straight to work in Lajamanu, working alongside our health and other frontline staff that are in Lajamanu. It was fantastic to see test results coming out of Lajamanu on Saturday evening, and that is thanks to the leadership of the health and other staff in Lajamanu. So we've done 147 tests in Lajamanu, and all of those pleasingly have returned back negative. And we also delivered around 20 vaccines in Lajamanu overnight. So we'll get the next round of wastewater testing back for Lajamanu later today, this evening, and we'll certainly update the community once we get that. Everything is looking very positive for Lajamanu, but it's certainly very early days. So we need the residents of Lajamanu to listen to their community leaders, listen to the teams on the ground. Please take this opportunity, if you're not vaccinated, to get vaccinated. We've got vaccination teams out there ready to provide you with what could be a life-saving vaccine. And we'll certainly monitor the wastewater around Lajamanu as we go forward. In terms of contact tracing, as we see the days pass by, the 14 days, people are starting to come off being close contacts. And so we now have 377 close contacts, and of those 370 have had a negative test. So that's very pleasing, and thank the patients of those individuals who've been identified as a close contact, having to go into isolation and subject to a testing regime, but that's certainly pleasing. There was over 1,800 tests conducted in the Northern Territory in the last 24 hours, which being a Sunday is also pleasing. So thanking everyone that is coming forward to be tested. The testing and that wastewater is our key to making sure we keep our community safe. It's a very important defence for us. And I also just want to touch upon the work that's happening in Central Australia. In Yuendamu, we know that the communities, that Larjamanu is connected to Kalkaringi and down to Larjamanu and other surrounding communities. And we're doing wastewater testing in a range of communities to help us identify. We need anyone in those communities, if they're not feeling well, to please reach out and get tested. We have rapid tests in a number of our clinics, and we can also provide that PCR test. But in Yuendamu, the community has responded by getting vaccinated. We delivered 16 doses yesterday, and I understand that there is people lining up to be vaccinated this morning in that community. And I was there just a few weeks ago. The health staff and the community leadership have done a great job in encouraging people to come forward for the vaccination. We've sent our vaccine bus from Alice Springs out to Yuendamu, so it will be in the community, and it's a wonderful opportunity. I again reiterate that the vaccine is safe, it is effective. Please talk to your local clinic about how important the vaccine is. Don't believe the misinformation that is being spread on social media. And just before I finish off on our remote communities, Robinson River has done a great job. We're heading in today to do the day 12 testing for that community, so things are looking very positive for residents of Robinson River. And so we again thank their community for getting vaccinated, but also making sure they're following that testing regime. I've also got an update, which I know the community will be keen to hear, around the positive case that we reported 2 days ago, the South African man who flew to Darwin on a repatriation flight on November 25th. That flight, as I understand, went from Johannesburg straight into Darwin. The individual went straight to the Centre for National Resilience, but I can confirm today that that genomic sequencing has shown that the man does have the Omicron variant of COVID-19, so the first case for the Northern Territory. But the Territory community should be reassured. The gentleman went straight to Housesprings, the Centre for National Resilience. He is in quarantine there. He'll be cared for appropriately. The quarantine facility itself is broken into different zones, so our international repatriations do not interact with any of our local community members, Territorians who may be in the facility as a close contact. So it is the first case of Omicron in the Northern Territory. Dr. Payne will speak, and then he will leave us to participate in AHPPC, and so we certainly will learn more about that variant as we go forward, and we wish that individual a speedy recovery. So I'll hand to Dr. Payne, then both Dr. Payne and I are happy to take questions on COVID before I can provide some comments around the Parliamentary Sittings Week. Thank you.
Thank you, Minister. So I just want to say a little bit about what we're dealing with now. So our focus is clearly at the moment on Larjamanu, but also on Katherine and Binjari. Robinson River is due to come out of its lockdown soon, and there'd be a round of testing done to ensure that that is safe. Turning to Katherine, the wastewater has shown us these low-level results, which are we call presumptive positives. They're subject to retesting, but we will continue to do that. And as the Minister has said, please come forward if you are in any way symptomatic. We do need to try and trace this down. It's possible that there is somebody in the community who is shedding and is the explanation for this at these low levels. It doesn't change any of our situation in Katherine with respect to our controls that we put in place, and thank the community again for all of your cooperation around that. And as the Minister has said, in Binjari we expected these new cases, and we're managing that. As to Larjamanu, as the Minister said, a huge effort gone in there, and we haven't turned up any positive cases. It's possible that there was somebody moved through the community, but we cannot conclude anything yet. We're still tracing the reason for that wastewater positive. I am aware that there are people in the community that are concerned that they may have been exposed and that they want to come forward to get vaccinated. As I said over the weekend, don't worry, you will be able to get vaccinated. If you wish to get vaccinated, there will be the ability to do that. I know that there are queues forming to get vaccinated, but please be assured that you will have access to vaccination. So come forward. In the morning, perhaps, when it's cooler, our teams will work in the mornings and evenings to support you with that, but also through the day. You might find it more convenient and actually more comfortable to come forward in the morning. So don't worry, even if there are queues, you will be able to get vaccinated.
You stay there, Charles.
Yes.
Sorry.
What would you say to people in communities where there isn't evidence of the virus being present yet? If people are queuing for vaccines in larger Manu at the moment, what would your message be to people in those other communities?
Yes. You can see that people are sensibly coming forward to get vaccinated. They're aware of this risk. We cannot know when it's going to appear again or where it might appear, either through this outbreak or through others. So those people that are coming forward are making obviously a very sensible decision, and I would support them and thank them for that, because by doing so they're not only protecting themselves, they're protecting others. And
with this Omicron case at Housesprings, how concerned are you about that?
I'm not overly concerned. We've dealt with variants all the way through this, and we've managed those in exactly the way that we're doing now. So in many senses, it's business as usual. We have a highly functioning quarantine facility there. We've had no breaches. This individual and the whole cohort of people, because they're on a repatriation flight, is in quarantine, and I would expect that to run as normal.
Would you expect more cases from the other people who were on that flight?
It's possible. We don't know whether it's more infectious at this point. We think it may be because of the mutations, but we don't actually have that evidence yet. So there may well be other cases on that. But we haven't had much transmission on flights. So it'll be an interesting outcome if there are some further cases on there because of the higher infectivity of this virus. But we just don't know that yet.
Thank you. Was there any further questions on COVID?
Is that case in a completely separate area to where those families were mingling a couple of days ago?
Yes, the case at Housesprings are international repatriations. We have Housesprings broken into different zones, and we care for people depending on whether they're international flight, whether they're domestic, whether they're a close contact. So completely separate area and not in any contact with local Territorians.
About the person who escaped from Housesprings on Saturday or Friday night, will their stay be extended or are they right to leave?
So in terms of that individual, police are investigating that matter. It's not acceptable that they thought that they had completed their quarantine and they felt they could leave. And so in terms of they have tested negative. I did provide that information to the community on Saturday. In terms of the clinical guidelines that need to be followed, I'd have to seek some further advice. Did you have any more COVID questions?
I have one about the interstate travellers coming in.
Okay, is it okay if Dr. Payne leaves us? He would like to attend AHPPC.
No.
Yeah, thank you, Dr. Payne. Sorry, go ahead.
No, with the PCR test, they have to do 72 hours beforehand. Is the negative result in the form of a text enough, or do they have to have a certificate of some sort?
No, so in terms of the PCR tests, as Australia gets more used to people providing a negative test, this is something that's commonplace overseas with travel, but we do accept a text message showing that that PCR test is negative. And remembering, if people want to play around with the system, the people that they're letting down is themselves and their community potentially. So I trust Territorians, we trust visitors, but there is penalties if people do fraudulently show and claim that they have had a negative test. And as we travel resumes to be more normal, those systems could well change into the future. So we've seen the vaccine passport, for example, so there might be other systems that come into place around that important negative testing.
And sorry, quick one on the Greek church was allowed to run services yesterday. Just wondering how that arrangement has been made.
So in terms of the Greek service, that would be questions for them, but people have to follow the CHO directions. Those directions are in place, and if you breach those directions, as I just spoke about, there is penalties. And so if anyone in the community believes that someone is not doing the right thing, then they should contact police or environmental health, the COVID hotline, and it certainly will be acted upon.
There have been a few reports about contractors who might not be vaccinated working on NT government-run sites. Who's policing whether the workers there are vaccinated?
So the CHO directions show that when you come into contact with vulnerable people, so Northern Territory Government, we're certainly moving in terms of government grants, government work, you need to be vaccinated, but that's being worked into contracts. So there could be existing contracts in place, and it could be that someone's not coming into contact with vulnerable people. So if anyone believes, again, that something is not right and that someone is breaching those CHO directions, police or environmental health, or they can reach out to NTG if it's specifically relating to an NT government contract. But there is a transition process in terms of government procurement, and we've spoken of that. But in terms of those CHO directions, they're quite clear. You need to be vaccinated if you're coming into contact with vulnerable people.
I've got a letter here that was sent by Andrew Kirkman that says that, and this was on the 8th of November, that says that people who are unvaccinated won't be able to work on government sites. You're saying that has actually been happening?
So I haven't seen that detail, but what I'm saying is the CHO directions are around people coming into contact with vulnerable people. There is also, if we were to go into a lockout, or presently Catherine is in a lockout, so that means that people that are fully vaccinated can go to work, they can go about their business, of course wearing a mask and being able to show that proof of vaccination. But if you're not vaccinated, you're locked down. So as the community gets more used to this, it is an important measure to keep us safe. But I'd be happy to look at that detail off camera. But in terms of NT government, if you have a government contract, you must uphold the CHO directions, but those CHO directions are principle based about coming into contact with vulnerable people. Was there any further questions around COVID?
Have you got an update on the police numbers in Catherine and the remote communities?
So in terms of our frontline response, I think it's worth acknowledging that there's been a very intense period, a lot of work by a lot of people, our police force, our health professionals, but they've also been supported by people from other agencies. And so they had a very busy period, and then Saturday evening, once we got this wastewater result, we had to then pivot resources to Lajamanu. So would like to acknowledge their efforts. I know that I don't have specific numbers, and I'd be happy to seek those off camera, but we had people, police officers, drive from Housesprings up to Catherine to provide that additional support, both physical resources and personnel. And so it's been a huge effort, and it's been a sustained effort. As you talked about the Chief Minister yesterday, it's 30 days yesterday since we had that case first come into the Territory. So, and this will go on for some time. So they're doing their normal duties. They've got this additional role. People have been seconded across to the COVID response, but we've just seen a phenomenal effort, whether it's our Aboriginal medical organisations, NTG personnel and community members working together. And I think that's apparent by the fact that we could get 60 odd test results out of Lajamanu on a Saturday night. The community turned around, the health teams went out and started testing people. NTG then supported them by getting those results into Darwin. So it's that teamwork that's going to keep our community safe from COVID. And just ahead of Parliament, it's the final parliamentary sittings begin tomorrow, and there is significant pieces of legislation. There is the Jabiru Town Development Repeal Bill, which changes the face of Jabiru to becoming that tourist and government service centre hub that the Commonwealth and Northern Territory Government have been working so closely on. That legislation is expected to pass. We'll also debate the Medicines, Poisons and Therapeutic Goods Act, which will ensure real-time pharmacy prescriptions in the Northern Territory. And we also have the Care and Protection Act 2007, which is being amended to improve government coordination and information sharing for child's wellbeing and safety. And there will be a conscience vote in the Northern Territory Parliament, something that doesn't happen often, around the medical termination of pregnancy bill, which is an important bill allowing Territory women to access the best health care, making decisions with their doctors and their clinical professionals. And so that will be a conscience vote this week in the Northern Territory Parliament. So 3 sittings days, it'll be very busy, but looking forward to a number of pieces of legislation being passed. Any questions on that?
Just on in the Federal Senate today, the private members bill of Senator McMahon for restoring territory rights has been introduced. Would the Northern Territory Government introduce euthanasia legislation if those rights are restored?
What we support is Territorians having their rights, having legislation that is passed in this Parliament House not being overturned by people thousands of kilometres away in Canberra. So we certainly support Territorians' rights to be equal to the other states. In terms of specific bills, we would first need to see the Commonwealth put that legislation in place that would allow us surety around that, and then we may consider any pieces of legislation that would come before the Northern Territory Parliament. Thank you.
I've got an unrelated question,
Yep.
sorry. Wisdom's popular bar with tourists and locals alike has been broken into 3 times this week. Are you worried we will see one of our biggest hospitality attractions collapse due to crime?
It's incredibly disappointing to hear that, and certainly the vibrancy of the Darwin CBD is something that people love, and particularly with our safety and freedoms we've had over the last 18 months, we've seen Darwin become a place where people come to have fun and to get away from those lockdowns on the East Coast. So our police officers work out there extremely hard to make sure that the community is safe, and certainly will consider, I imagine there's a police investigation into those break-ins. Thank you.
I wasn't meant to be in this room. Upstairs, something like that.